Passengers are heading home today from the hantavirus-hit cruise ship, now anchored off Tenerife in Spain's Canary Islands. Officials say none of the nearly 150 people on the MV Hondias are showing symptoms of the virus, which has killed 3 people. But teams from the CDC are on site to meet these disembarked Americans, and they're also expected to usher them to Nebraska's national quarantine unit. But that is reportedly not being required. For more, let's bring in the acting director of the Department of Epidemic and Pandemic Threat Management at the World Health Organization, Maria van Kerkhove. Thank you so much, Maria, for being with us. Really appreciate it this morning.
Thanks so much for having me.
So we have seen these videos of protests in Tenerife. People are fearful about a deadly disease coming to their shores. The head of the World Health Organization posted a long letter to X trying to quell concerns, writing, "Spain's authorities have prepared a careful step-by-step plan. Passengers will be ferried ashore at the industrial port of Granadilla, far from residential areas, in sealed guarded vehicles through a completely cordoned off corridor and repatriated directly to their home countries. You will not encounter them. Your families will not encounter them." But how many countries are these passengers going to? And how confident are you that the virus is not going to spread once they're back in their homes?
So thanks very much for doing this update. And indeed, our Director General is actually on the ground right now overseeing the operations. And it is a careful step-by-step operation of moving the passengers and the crew from the ship to shore through buses in a cordoned off way to repatriation flights. We currently have 23 countries that have nationalities on board, either through passengers or crew. Right now, we're working with the Spanish authorities from the Netherlands, and these countries on the repatriation flights. The flight started this morning, or the operation started this morning at 7:30 local time, and will continue to about 7:30, 8 o'clock tonight, and then continue tomorrow. And so far, we have flights that have gone to Spain, to France, to Canada, and the Netherlands in progress. I'm checking my notes because this is almost in real time. And we have flights planned today for Ireland, Turkey, UK, Ireland, and the US. That might change, so please bear with us as operations on the ground. It's in a live situation, but this is a very different virus than COVID. It's not COVID. The passengers and the crew on board will be wearing respirators as they leave. There's a medical assessment that is being done on board before they disembark from the ship. They will be transported separately and directly to these repatriation flights. These are not commercial flights where they will go back to their home countries, and they will have an active follow-up period once they reach their home countries.
So let's talk about that piece for a moment, because the repatriated Americans are going to Nebraska. It is home to the only federally funded quarantine facility in the United States. But according to ABC News, it does not sound like U.S. officials are going to require any use of that center there. They're telling reporters this on a call, according to ABC. "We're not quarantining anybody," a CDC official told reporters on a call Saturday. When asked if passengers will be tested, a CDC official said it is not recommended to test people that do not have symptoms. Is this the plan that U.S. health officials have communicated to the World Health Organization? Have they told you this is what's going to happen? And is this consistent with recommendations that you guys have?
Well, yes. I mean, let me tell you what our recommendations are. And what I do want to point out is that we are working with CDC officials, and we're working with many different countries that are actually involved in this, requiring a multi-country response because we want to make sure that we prevent any further spread. Our recommendations are, we're considering everyone on board, the crew and the passengers, as high-risk contacts, because there are current investigations that are really trying to understand what types of exposures each of them had. And because there's so much uncertainty at the moment, we've recommended that everybody be considered a high-risk contact. Our recommendations are that everyone who goes back to their home country is followed up with active follow-up for 42 days. This would include checks, health checks by authorities, and either be quarantined at home or quarantined in a medical facility.
Okay, so this report goes on to say that the CDC is sending passengers home to monitor from there. It's unclear from what we're trying to gather if that transportation would be private. It sounds like that is a concern, obviously, for spread. But in the meantime, President Trump was asked if, given all of this, the U.S. is reconsidering rejoining the World Health Organization. Here's what he told reporters.
Your team traveled to Moscow, Mr. President.
Consider leaving the World Health Organization because of the outbreak.
outbreak of hantavirus?
No, we seem to have things under very good control. They know that virus very well. It's been around a long time. Not easily transferable, unlike COVID. But we'll see. We're studying it very closely. We have very good people studying it very closely.
So an NBC report raises the concern that potentially not being a member state would result in a delay of advanced data that would typically go to member states. That same report does note that the World Health Organization is working, hand in glove with U.S. officials. But what can you say about whether there is any delay in exchanging information, and is the U.S. at all at risk of not getting it early enough?
Well, we do hope that the U.S. does reconsider and remain as a member state of the World Health Organization, because the viruses that we deal with, hantavirus included, they don't respect borders, they don't care about our politics, and information saves lives. So what we do through using the international health regulations is share information immediately once we know about it. And that's what happened in this case. We learned about these first cases, we learned about the link with the cruise ship. There's an incredible amount of expertise coming together, particularly dealing with the Andes virus, which is one of the hantaviruses associated in this case here. We're actually working with Argentina and Chile, as well as the U.S. and many European countries to share that information. And I think this is what is really important about what we call multilateralism, which just means we all work together, because we need the best minds together, including the best minds from the U.S. CDC, to work with us to tackle these challenging problems. Sometimes there could be a delay in information that's shared, but I do also want to say, while I have the floor here, is that the University of Nebraska, this center that you mentioned, is a GORN member, the Global Outbreak Alert and Response System. This is the WHO network that has been in operation for more than 25 years, and it's actually been a GORN member since 2018. So we will continue to work with everyone everywhere, because our goal is to keep people safe. That includes everyone everywhere, including Americans.
Just to clarify, you say there could be a delay, but is the World Health Organization giving information, in real time to the United States, even while they're not?
Absolutely.
Okay, great. That was the answer I was
Yes,
looking for.
absolutely. So our goal is to share information that saves lives. We're doing regular risk assessments, and we're sharing that information in real time so that countries can update what they actually want to do. We make recommendations, and governments decide what they want to do in terms of policies. So that information is being shared through the international health regulations. The United States still participates in that, which is really critical, again, to tackle the problems that we have, put the risk in context. And I do want to say here, I know there's a lot of news about this and people may be scared, but this is not COVID. It's a very, very different virus. The risk to the general public, the risk to Americans is very low. Everyone who is traveling back from the ship will be done in repatriated planes, so not commercial airlines. Okay. And it's very, very carefully choreographed, and WHO is coordinating this with officials in the field.
I'm sure you guys have a lot of people on this, because a lot of folks are, rightly worried. And remember, just a few years ago, everything we were dealing with. I don't think anyone wants to bring back masks anytime soon. So Maria Van Kerkhove, thank you very much for joining us. Appreciate your time.
Thanks. Thank you.
Be sure to like and subscribe for all the Fox News latest on YouTube, and catch full shows streaming now on Fox One.